All right, welcome back, and we're ready. We'll dive right in with our first question.
I don't eat much and I eat healthy. Why can't I lose weight? Dawn.
Thank you, Dawn. That's a great question, and one that I get really often. People often come in because they feel like they're eating healthy already, or they don't eat much at all and they can't lose weight, or they've tried to lose the excess weight or excess body fat on their own. So really, I've found out that it's one of a few things. People are normally, there's normally hidden calories that's happening, and they hide in a few different places. So one, I've noticed that, people may be going out to eat more than usual. If you really go through, okay, what have you been doing? Why we eat healthy Monday through Thursday, but then Friday comes and then it's the weekend and they may go out to a restaurant a couple of times or even one time a week. And recent studies and statistics have shown that a restaurant meal, if you go out have just something, pizza, stir-fried rice, or maybe like a hamburger just once a week, maybe if you have a glass of wine or whatnot with that sometimes at some restaurants can reach up to like 3,000 calories. So at that point, it's a game of math. It takes, a pound is roughly 3,500 calories, and you're not losing that weight because the weight that you've it kind of counterbalances what you're doing during the week. So going a little and that's not to say that you can never go out, of course, and enjoy a meal. It just means that this is probably what's tripping them up, and they're not being consistent enough with the healthy eating. Another one I get is I have to go into, okay, how much alcohol are you drinking? And they may be having a couple glasses of wine a night, or a glass of wine a night, or other alcoholic beverage, and that, simply put, slows down their fat loss. So usually after we kick that out and clean up their restaurant eating or going out, they will begin to see some results. The other two things that they're really kind of unexpected is people are really, if they are eating really the right foods, they're eating whole foods, but they're eating too much of those whole foods. They're eating too much of a good thing. So this would be like having a cup of nuts instead of maybe reducing that, that's over 5 to 1,000 calories, or having, half a cup of guacamole or something like that. So hidden calories there. So we have to get those portion sizes corrected. And then the other thing that's commonly is maybe they aren't eating enough. I have some people that are just chronically undereat, which isn't healthy either. They're having breakfast and they're having dinner, but they're skipping lunch. So they're skipping meals. And sometimes that really stalls them out, and we get them eating a nice healthy lunch, and then the excess body fat comes off, and they're very happy with their results. So it's it just depends on people's lifestyle and what they're doing and what their habits are. But those are some of the common things why people are eating healthy but not seeing results.
I exercise 5 days a week, and I still can't get rid of the excess weight. What can I do? Madison.
Thanks, Madison. Yes, that's another common one. Exercising. And while exercising, and I feel like we hear this a lot, exercising is a great thing, but I think we need to think of exercising less as a weight loss tool and more of a weight maintenance tool, or a way to build muscle mass and maybe improve longevity. But really, exercise, it's the old adage, you can't out-exercise a bad diet. So it's really, again, you are just, you're not really eating, it's your nutrition that isn't matching that diet. So we want to take a deep dive and a deep look at nutrition and what you're eating. Are you eating the right things? Are you having too many protein bars or too many maybe sugary drinks afterwards? It's the nutrition piece is often what causes those people that work out a lot but they can't see results. Again, it comes down to the nutrition. All right, those are all great questions, and we'll be back shortly to answer some more.
You asked and we listened. Now offering semaglutide, FDA-approved treatment, decreases appetite and cravings, improves insulin resistance, administered once weekly, safe, affordable, physician-led program. Call now to schedule your semaglutide consultation.
Going metabolic. Going metabolic. We were meant to be. We were meant to be. We were meant to be. We were meant to be.
All right, welcome back, and we are ready to take another question.
If I lose weight on your program, am I going to just gain it all back? Paula.
All right, Paula, that's another great question. So it depends. We always say we don't want you it's not just a diet, it's a lifestyle change. So we really work with you in any kind of program or nutrition change that you make to lose weight or to lose that excess body fat. You want to make it a lifestyle. So if you do lose the weight, but you don't make it a lifestyle and go back to eating the way you were before at the same activity level, the weight will creep back up. However, that's why we work with you to find, what kind of diet, what kind of nutrition is right for your biomarkers, your unique metabolism, and help you tailor that nutrition and activity to your preference, your lifestyle, and what you enjoy. Weight loss, as I say, it's two phases. It's where you're actively losing excess fat, and then it's maintenance. It's maintaining those results for true long-term weight loss. But that's kind of the long and short of it. If you do it correctly, no. But if you do go back to those old eating habits, you can regain. But that's why we have a program set up and support and accountability so that you can make those true lifestyle changes.
Why do I have more belly fat since menopause? I'm doing the exact same things that I've always done, but I keep gaining weight? Courtney.
Some of the studies show that as we age, especially women, unfortunately, our hormones change and we become more insulin resistant. So that results in more fat around our midsections. So, it happens almost to everyone. And the way to combat this is really to focus on those foods and things that just combat that insulin resistance. Sometimes for some it's just those more lower carbohydrate or diet, or really shifting into those whole grain type foods depending on how much excess fat you want to lose. Also, strength training is huge to really help that improve your body's insulin sensitivity. So that's one thing we work on with patients. And if you have, there's some biomarkers you can look at and some other labs, also to make sure that you're getting the right vitamins, and even adding in some supplements, or in some cases, if it's severe, medications to help you reduce that belly fat that does come on as we age. We can definitely do something about it, so there's no need to get discouraged, but we just have to do the right things for you and your metabolism, your physiology, to see and get those results. Those were great questions today. We're going to take another small break, and then we'll come back and wrap it up. Thanks so much.
You asked and we listened. Now offering semaglutide, FDA-approved treatment, decreases appetite and cravings, improves insulin resistance, administered once weekly, safe, affordable, physician-led program. Call now to schedule your semaglutide consultation.
Going metabolic. Going metabolic. We were meant to be. We were meant to be. We were meant to be. We were meant to be.
Welcome back. We have one last question today from Sarah.
What is your opinion on weight loss medications?
That one is one I get asked frequently, and I like to tell people weight loss medications, I like to look at them as a tool to help you make those lifestyle and diet changes. They work synergistically with a good nutrition plan and exercise program. They're not really a magic bullet, but they allow you just to shift your focus on eating healthy and make those changes a little bit easier until they become a habit. A couple common ones I know in the news are the semaglutide, and we also, with my clinic, offer appetite suppressants. And again, these things that there's a doctor that has, we have physician oversight. So we take these medications and we tailor them to when they're used correctly, they can really be tailored to the unique individual's needs and what their lab work looks like. We use that data to come up with a treatment plan with them. So they can be abused if they're used if they're not used correctly. But again, when they're used under a doctor's supervision, they can be very very helpful. And we also have to take a look, who are these medications for? Well, they're not for people who just want to tone up or lose maybe 10 to 15 vanity pounds. They're really for those people who are at risk for health issues from excess weight. Health issues such as diabetes, prediabetes, high blood pressure, dyslipidemia, those things that can really, after a lifetime of suffering from this, can lead an end result in heart attack, stroke, dependence on insulin if you're a type 2 diabetic. So really the risk and benefit ratio is the benefits from taking these medications to help you get rid of that excess body fat, to help beat metabolic syndrome, is really a way less risky in the long run than developing one of these other conditions if it's done the right and the correct way. And that's at least at our center, that's what we want to do. We want to do things the correct way in a safe environment where you have accountability and things are titrated to you based on effectiveness, but also to minimize any kind of risk factors or side effects. So if they're used properly, they can be a good thing. Are they for everybody? Definitely not. Can someone make those lifestyle changes without any medications? Certainly, and we have certainly helped many people do that. But a lot of people do like that, just an extra boost to get started. But it's not something that's required, and there's never any pressure to do that. There's other ways to develop support, to have support, whether it's one-on-one or in a group, also, and have a tailored nutrition plan or even supplements that can help you do that without medications. So whichever route you choose, we want to get you to be able to live your best, your healthiest lifestyle to prevent any kind of disease, and in the future we want you to have a nice enjoy your golden years and things later on in life, and not have any of these terrible like heart attack, stroke, those kind of things that can come from metabolic syndrome, excess body fat that we all know about. At Metabolic Medical Center, we're really excited again to get our show off and running, and we'll be doing podcasts weekly, and tune in for the Metabolic Minutes, again, to give you inspiration, and tell your friends, because we really want to develop a community here, a community that can support each other, that can lean on each other, and help each other live better, healthier lives.